Welcome to the Most Wired podcast series, featuring interviews with leading CIOs at hospitals and health networks' most wired hospitals. This segment is produced by H&HN and is made possible through the generous support of McKesson.
My name is Sarah Brown, and I'm the project specialist for the Most Wired survey and benchmarking study. Today, I'm speaking with Michael Krouse, Senior Vice President and Chief Information Officer at OhioHealth in Columbus, Ohio. OhioHealth's Dublin Methodist Hospital is a 2008 Most Wired Award winner. So, Michael, let's start with an overview of Dublin Methodist Hospital. I understand it's all digital.
It is all digital. It's the newest of our hospitals in the Ohio Health System. It's a 95-bed facility located in the northwest of downtown Columbus, Ohio. It was the ultimate place that we wanted to take all of the things that we were doing in our other facilities from an electronic and digitization perspective, and we wanted to blend them all into a single facility. And I think we accomplished that.
Have there been any initial challenges with that?
Well, there have been quite a host of challenges. As anybody that has tried to implement as much digitalization as they can attest, we started with a blank piece of paper, which is pretty unusual in today's environment. The benefit of starting from square one in designing the hospital from the ground up helped us tremendously. But as with anything, when you're trying to run as many as 160 different applications and quite a host of variety of different devices across a wireless infrastructure, there are problems that you run into. We implemented wireless infrastructure ABG bands, and they were not as sophisticated as the multi-band technology that's out today with N. That posed some additional problems when we're trying to load communication devices, mobile notebooks and laptops, mobile medical devices, all running on the same wireless infrastructure, and that sometimes is difficult to kind of sort its way out. And even after we opened, we spent several months trying to fine-tune the wireless infrastructure. But I would say that's probably the biggest issue that we've had to deal with on a go-forward basis.
Michael, since you have a completely mobile workforce, have you tried to standardize on a particular device?
One thing that's really important to remember is that no single device is going to work across the wide variety of care requirements and workflow and processes, which is why we have the notebooks, we have the laptops, we have touch pads, we have small form factor devices, we have the patient station, we have C5 devices. We were not able to really standardize on a single device, nor were we trying to standardize, because every one of these has its pros and cons, and every one of them works in different ways to make a particular caregiver more efficient than not. And I just encourage folks to create infrastructure that allow you to support multiple devices, and don't try and force or standardize on a single device, because you won't maximize the workflow of every caregiver, and that's ultimately your goal.
With such a range of devices and widespread access to them, how has security been?
Security's actually been very good. Every device has an RFID tag embedded in it, so we're able to track those devices, and there's a whole series of alarms that go off if that device ever leaves the campus, and security has a set of processes for locking things down and immediately tracking down that device. We have the ability to track for at least for a short distance outside the parameter of the facility. So we've not had any cases that I'm aware of where a device has been stolen or removed from campus. We have no concern about the devices taking particular patient information off-site, because it's all encrypted, and there's no ability for anyone to get at that information. From a security perspective, we are protecting our patients utmost and foremost, but we also, of course, don't like to lose the value of our asset.
At Dublin Methodist Hospital, 95% of your medication orders entered electronically are done so by physicians. How did you make that happen, and what has been the response from your physician community?
Again, one of the beauties of being new and building a facility from the ground up is you have the opportunity to set process and expectations with the physician community from day one. We actually addressed in the medical staff bylaws that physicians would enter their orders electronically. If they were going to practice at this facility, that was a requirement of practicing at Dublin. Verbal orders are only accepted during emergency situations. Telephone orders have been minimized. So we have the ability for the physician to log in remotely and through unique identification place the order electronically as well from their home. They responded quite favorably. However, after the fact, because we are a very large system, we do find that several of our physicians practice in both environments. So they may be at one facility where we don't have 100% CPOE and then migrate over to Dublin, which is 100% CPOE. So what we're finding is some level of frustration on a very small number of physicians that do practice in both environments because they'd like to see some consistency. And I think that's a fair statement, a fair request. Unfortunately, we don't have the ability to just flip the CPOE switch across all 16 of our hospitals simultaneously. It's kind of a systematic rollout. And so we're going to have to be dealing with that change. And they recognize that. It's just, I think, somewhat frustrating.
Dublin Methodist is partnered with the Pebble Project, which encourages a design aspect to care that promotes the healing process. Besides the hospital's architecture, how has the Pebble Project affected Dublin?
Yeah, the Pebble Project, when you adopt that kind of a philosophy, as we did in building the facility, you have to be able to marry it up with the types of technology that allow that natural healing environment to be non-disrupted. Imagine, for example, if we were really trying to drive a quiet, restful healing environment, and yet we didn't have the technology to eliminate things like overhead paging and the types of noise that can be disruptive to that environment. So we really blended these two, and I think that's what makes this particular Pebble project so unique. It's the only one that I'm aware of out of the 40-plus hospitals across the country that are fully digital.
Is Dublin the model for the rest of OhioHealth?
It is. While it's not yet perfection, I would say certainly that it is the model that we are deploying, and we are currently pursuing rolling that model out to our other facilities. You know, Dublin's a pretty unique environment. When you're digital, the types of tools and technology that have been deployed out there are pretty extensive. We have communication devices, which we refer to as Vocera badges, that everyone wears, including the physicians and the hospital president, such that clinicians receive patient alerts and codes all directly to this badge instead of overhead paging, which then contributes to kind of a peaceful healing environment. We have a product called MARTI, which is My Accessible Real-Time Trusted Interpreter, which is a mobile interpretive services. We do have a large contingent of non-English speaking patients that will often frequent Dublin. And in this case, literally with the push of a button and a mobile cart, we have the ability to communicate and interpret with virtually anyone, inclusive of sign language needs. We have active RFID devices that track all our IT equipment, all of the medical devices. We can track at any one time so we know where those devices are located. We have a mobile EICU environment, and a lot of that is kind of blending the technology with the original design of the facility, which was focused on increasing the healing environment. So for Dublin, it's a question of maximizing the technologies that have been deployed, doing everything we can to take full advantage of them. And as we're doing that and learning, we're able to take that learned process and simply make it happen at the new facilities, which is why I say that I would say that in 3 years, Dublin will be at a point where it is taking full advantage of everything that we've put in there. And as it gets busier and busier over the years, it will simply be a truly paperless environment that sets the tone for everything else that we do.
Thanks for listening. Please join us in a few weeks for another Most Wired podcast. For more on Most Wired products, visit www.hhnmostwired.com.